All right, so leading off, you're excited about this. I am just, well, I finished my surgery yesterday. We started it the day before yesterday. I had about 10 places in my mouth that we worked with root canals and wisdom teeth extraction areas. We did all kinds of stuff. My temperature was up a full degree because there's healing. You know, I looked at my aura ring.
Of course.
And obviously there's a lot of healing taking place. But my HRV doubled.
Which is amazing.
My HRV was literally the highest it's ever been in my life.
It's just insane or amazing. That's the fulfilling part, right?
While I'm still healing. I'm not even like at my best yet. So this is pretty exciting just to lead off. So anyway, that is really, really exciting. Highest HRV ever. So I plan on getting more restful sleep, more recovery, more longevity, better health in general. I mean, there's really not a better predictor of your health and wellness than HRV.
Yes.
And to have it be the highest that it's ever been, to have it double overnight is pretty exciting.
It's exciting. It happens often, but usually not on the second day after, like the day after surgery is usually when the HRV, I would expect to tank a little bit and then come up higher, but I mean...
But with me,
it's crazy.
You did a lot of work. A lot. And I think while there's a lot of healing to do, I think you removed, I mean, just in the wisdom tooth extraction areas, you said that there was, I mean, areas like this big that you were cleaning out, right?
I would say all the 4 cavitations from the wisdom tooth, the fatty degenerative osteonecrotic jawbone, I would say it was roughly, let's say 6 cubic centimeters of chronic inflammation. Imagine 6 cubic, like this is 6 by 6 by 6. If you had that on your arm, you would freak out, right? And this is all fatty tissue. This is all chronic inflammation. There's toxins in there, heavy metals, glyphosate. It's all getting stored there. And obviously viruses, parasites, fungi, anaerobic bacteria. So that is, and this is something you didn't even feel before, right? I just had to dig it out and it was insane. Like,
for people in the US, it's about 2.5 inches. This is a huge space, like literally like that. So yeah. So a lot of work was done. But starting off, I have some questions that we can roll through. I mean, tell me, you know, kind of quick hit answers. Like, what is biological dentistry? How does it differ from regular dentistry?
Yeah, so regular dentistry or conventional dentistry is basically focusing on the bite. Like, teeth are tiny biting instruments that you can chew on. Obviously, it's about pain treatment and also maybe about aesthetics. So whatever he came in with, if you show that to an insurance company or a regular dentist, they will tell you it's all fine. It works. You can bite on it. And that's correct. He can totally bite on it. But the mouth is a part of the body. So biodentistry basically means that the mouth is part of the body. What a surprise. And what we do is we combine or we fuse the high-tech dental skills, the craftsmanship, with functional medicine and health optimization or biohacking, whatever you want to call it, with that focus on healing the patient overall. And this is something you do not learn in university. It's just, in my opinion, it's just the next level. It's the dental evolution to become a full doctor, a full healer, so to speak.
So given that, like, how far away do you think we are from everyone understanding what it is you understand? Are we 5 years out, 10 years out, 20 years out? Like, how long will it take for conventional dentistry to catch up?
So being on that journey for quite a while, 15 years now. Now we're at, let's say, 0.3% of all dentists who know about, for example, ceramic implants. Mm-hmm. So I would just estimate that biodentistry is even less. Mm-hmm. So because it took already so long, I'd say we're more like 20, 30 years out from this. Unfortunately, unless someone like has a lot of power and pulls a plug and warp speeds this, but just by our work as these tiny biodentists, the Jedi dentists, it will just take longer than expected. So I mean, now after our pandemics and stuff, the health consciousness definitely changed. So people are more aware, I would say. And I mean, 19, when my book came out, I had tons of shitstorms about the stuff we're doing, mainly from colleagues. That changed a little bit because 50% of what was in the book, what was attacked, is now like school medicine. It's basically guidelines. It became guidelines. So that changed, and I can see that there are more and more open-minded, I always say young and wild dentists that want to become real biodentists, that I'm training in the biodentistry certification. But yeah, I think we need some sort of an accelerator.
Mm-hmm. So you'd guess right now maybe 1 in 1,000 dentists are biological dentists?
Yes, but biological dentist is not a real definition. Like this is what I describe you. The next level is biodentistry 3.0, is melting it. Like it's the high-tech dentistry with the functional medicine and health optimization, versus a normal biological dentist or a holistic dentist. They're just doing that high-tech dental part, just using no metals. Maybe they even do root canals, but hopefully they don't. And maybe they put in ceramic implants. So that's really, in that biological dentistry world, there's still a big discrepancy from what you see here. This is more like 0.001%. I mean, now I'm having a global training, and we're getting more and more certified real biodentists. The real bees is what I call it, like Wu-Tang Killer Bee.
Wu-Tang Killer.
Also a bit funny, right?
Yeah. So you talk about health starts in the mouth. Like, tell me about that.
I mean, so optimal health starts in the mouth, and the mouth is the entrance to the body. It's the entrance to the gut system. You know, your gut system is kind of like that tube that goes usually from here till the end, but it actually starts here. And whatever you do in the mouth will also be affecting the overall body. So, I mean, the mouth is the entrance. There's a huge microbiome. It is the second largest, most diversified microbiome in the complete system.
And you said about 50% of your gut microbiome is from your mouth.
Exactly. Because you swallow about 140 billion, let's say, bucks per day. Yeah, that's 50% of your gut. So if your mouth is in not good shape, your overall body can't be. It's just not possible. The problem here is, again, as dentists, we're only focusing on repair, like a garage. But dental repair is the biggest trigger. Because, like you know, root canals are dead body parts. So there's always different bacteria lurking in there. Then we have the cavitation, there's another area. And we have the different metals. So having all this, Sean definitely had dysbiosis. We also measured it. Like, there's viruses, fungi, candida, mold. And there's a big thing in the US is mold problems. And mold spores oftentimes live in these areas because the immune system cannot really get there. The macrophages are just too big to go into a tooth or get into this. So this is why we need to fix dysbiosis and toxicity and immune problems, and then obviously very easy to heal the gut system afterwards.
So what are the hidden dangers of root canals? Because they're so common. I had 5. Never knew that they were bad. I thought that I was doing a good thing. No one ever told me any different.
Yeah. So I mean, root canals are a fine art. This is one of the biggest, probably, I wouldn't say money makers, but one of the biggest procedures regular dentists need to do. And actually they have to do it for you because you need a pain treatment usually, or have deep holes or deep cavities, and it's just painful, and then the root canal helps for this so that you can bite. The hidden dangers, they're focusing not on the biting but on the overall health problems. So a root canal, basically what we do, we take out the lymph, the blood, the nerve supply of that tooth, which was an organ before, but now it becomes a dead shell. And if you look at a root canal on an electron microscope, it has about 30 to 75,000 dentin tubules per square millimeter. So one root is about 1 kilometer of length if you attach those to each other. So that's 0.6 miles. And this is a perfect cave system for anaerobic bacteria, and they will just lurk in there because a healthy tooth obviously has a blood supply and an immune system. There are studies showing this. The immune system can attack invaders, but there is no more immune system. So the only way your body can like help itself against that chronic infection in that tooth is by building either a cyst on the tip of the root, which you not always see on a normal 2-dimensional x-ray, but on a cone beam, or in your case, can protect it by building harder bone around it, kind of like a wall. That's the two options. So you had the wall. Most people have cysts.
Okay. So speaking of cavitations, tell me about like what does that mean?
So cavitations is the layman's term for a medical condition called FDOJ, fatty degenerative osteonecrotic jawbone, which is completely unknown in dental school. We don't train that. We're not learning this. This is something that is obviously well known if you look about it, but nothing that a dentist learns about. And basically what it is if you had any sort of teeth extracted, and this is why I always ask, have you had your wisdom teeth extracted? Because 80% I would estimate of all the Westerners have them pulled because of spacing issues. We're just growing too narrow because of lack of nutrients, processed foods, whatever, all the Western price stuff. And what happens is we're not preparing our patients, usually it's teenagers, they're growing, they're having massive nutritional deficiencies, lack of sunlight, vitamin D3 is too low, magnesium too low, protein too low, everything, and wrong food. So the only thing we prepare as usual, as conventional surgeons and dentists, is what can you do locally against the swelling? Applying cold, using anti-inflammatory drugs, and maybe an antibiotic. That's it. So there's no teachings about overall systemic healing, which we do here. So what happens, the body's not prepared, is in shock from that trauma, is in hibernation mode, not anabolic but catabolic, and it can't build bone. So it's a secondary healing oftentimes. Patients have to come back in because it doesn't heal, it doesn't bleed, it's dry socket. And then, over time, the body is just able to put gum on top and a little bit of bone surrounding it, but inside is no spongeous bone, but a cavitation, which is, in your case, was just perfect textbook fatty degenerative tissue. Like really, I could just suck it out. And it's kind of like cystic tissue, and fatty bone, yellow bone, is chronic inflammation. And you know that chronic inflammation is trigger number one for any chronic health issues.
Right.
This part no one knows.
Right. Yeah, inflammation is part of the disease process when it's in a chronic state of inflammation, and you can look at CRP, IL-6, all these different things.
Yes.
Metal. Yeah, go ahead.
I mean, look at Sean now. This is like, I would have done 12 wisdom tooth surgeries in one day. And normally, one wisdom tooth surgery, kids look like this, right? Swollen, can't eat for days and days, just because they're not prepared. Look at him. He had like the 3x amount of that kind of surgery. There's barely swelling. Little bit maybe, right? Not how much is the pain?
Very low.
Very low. Look, perfect.
You're good at what you do. So metal fillings, tell me about, I had titanium implants here since I was a child. I had a gold crown. It's very common to have metal cavities. I mean, tell me about metal in the mouth.
So metal in the mouth is just, this comes from, like, let's say the previous century, where we only had metals to repair, like this. Gray mercury containing fillings, the black ones. Then we have gold crowns, or different alloys, palladium. Dentists are able, or lab technicians are able to use any sort of metal in your mouth, even nickel. Or for him, the titanium implant. Titanium is usually not the biggest problem when it comes to toxicity, but immunological wise, people will react to it. So for metals in general, there's always 3 challenges. It could be the toxicity, the mercury filling. I mean, mercury is the most toxic non-radioactive element known to man. Yeah,
and it creates, if I remember, I've heard this, that when you grind your teeth, like a lot of people grind their teeth at night in particular, that the mercury filling can create actually methyl mercury gas, which is supposedly very toxic when you breathe it in just from you like grinding your teeth.
Yeah, so it's grinding, chewing, acidic drinks, dental hygienist, all this stuff, brushing even. It's mercury vapor that comes out, it's HC0, but as soon as it comes in contact with, let's say, a methyl donor or like another amino acid, or with bacteria usually are able to produce these methyl mercury or dimethyl mercury even. And this one, there's no protection. It just goes into the cell. For example, Karen Weatherhan, who was I think she was a chemist trying to manipulate DNA by using dimethyl mercury, and she got one drop on her glove, and she died six months later because there was no more chelation, nothing could help, because it was just a too high dose to chelate it out of her. So
wow.
she basically, Google it, Karen Weatherhan. I didn't invent
That's
it.
insane.
So toxicity, we have immune system. Your immune system can become allergic to anything, even the titanium. It's more or less sensitivity. And then third one is we're living in 3G, 4G, 5G, EMF world. It's an antenna. Like, it's just that simple.
You were telling me, one, because I had the titanium implant and then the gold crown, that this creates a battery. And two,
Yes.
you were telling me with a titanium implant that it can conduct the EMF and even heat up to as much as 140 degrees Celsius, which is over 300 degrees Fahrenheit. Is that correct?
Wait, it can heat up? No, I would say it can heat up more like 4 degrees more, like high fever.
Oh, okay.
That's what it is. Like if you, for example, there's studies showing if you have a call with your cell phone, usually the electromagnetic waves go to the cell phone and then back to the tower. If you have a titanium implant, it can heat up, and this is basically high fever in your bone. Your bone doesn't like heat. So that's why the bone oftentimes around a titanium implant is cavitation. It's just melted away and still sticking in there, because it's always, a titanium implant is always not really osseointegrated. It's more like an ongoing chronic inflammation due to the cytokines you mentioned, versus the ceramic implant that we use is completely neutral, electrically neutral and immunologically neutral, and it only osseointegrates with your body if you're anabolic and just build bone. There's never any cytokines. That's amazing. Like, and also gum attaches to it.
And so what was the interaction with the gold and titanium, though?
That was the better. That was completely correct. So if you have different metals, for example, just titanium and gold, and in your saliva, in your mouth is saliva, which is an electrolyte, ions will leach out. And then ions in an electrolyte, they travel from the anode to the cathode. And that's called a galvanic element or simple battery. Just imagine a propeller of a boat in the sea. It rusts. Same happens there. So these metals can even rust.
So typically, at most dentists, you're going to just get x-rays. You're not going to get cone beams. What is missing when you're only getting x-rays?
So a normal X-ray is two-dimensional. That means you have only this projection of the rays, and what you often miss is, for example, if you have a root canal and the projection goes here and the cyst is more to that side, you don't even see it. So what we do is always, as a gold standard, we use a cone beam scan, which is a three-dimensional X-ray, because then we can really look around that tooth and see the bone and see the nerves and see that cysts.
And the sinuses, right?
See the sinuses. I mean, I'm an oral surgeon, so it should be gold standard to do any kind of surgery. Even the conventional dentist should have a cone beam if he's a surgeon, because it's just, I mean, it's existing. If you don't use it these days, that's really old school, and I mean, you can hurt stuff that you shouldn't. For
Right.
example, your nerve or whatever.
Okay, so how about, I mean, besides me, you've had a lot of people come through here. You've had success stories.
Yes.
Anecdotal feedback. What would you say are some of the more impressive things that you've heard attributed to this procedure that you're doing, just transformations?
This one I could probably go on for hours. So from transformations, we had everything. Let's say 10 years ago, it was more like most patients were super sick, and they needed it to an intro, and they oftentimes had seen 29 different integrative medical doctors. No one could help them. I remember one specifically, he didn't tell me what he had, but on the next day he told me I was suicidal, for example, and 80-90% of my depression, anxiety, it's all gone. I'm like back to 30 years ago. This is how I realized, okay, mental health issues are directly connected maybe to these things, stuff that you also talk about. But also, like, just these chronic problems. Patients will always tell you afterwards something changed. So last week was a woman here, she this is one that gives me goosebumps, because she told me she had migraine from when she was 18 years. Now she's 51, and I did her surgery 4 months ago, and I just saw her for the second stage, and she's like, migraines are gone. Never had any afterwards. So she was suffering for 30 years, same as you, roundabout, like 5 root canals, couple of titanium implants, cavitation, and then it's gone. I obviously cannot predict this, but this always happens. Or Brad lately was here. He had seen good integrative medical doctors. I think he was even at Hyman's clinic, and this is where they tested a lot of. They even tested oral microbiome, and he always had high rheumatoid factor and joint issues, and no one could find it until one doctor over there said, "Hey, maybe it's your teeth," but he was already 10 years into his journey, and then he came to see us again, like you. Root canal is always the same: no metals, no root canals, no cavitations. We did this procedure, and this is something you could look into my Instagram. He gave me a testimony. It's like, people wouldn't believe it. It's 1 day after surgery, and I have no more joint issues. Yeah, and then he sent me his oral microbiome measurements that he had from pre-surgery, where there was always one germ, and a pathogen called Porphyronas gingivalis was always elevated. And this one is directly from research connected to rheumatoid arthritis, and his rheumatoid arthritis factor was always super high. So he shows me the next oral microbiome test 4 weeks after surgery, and there's no more Porphyronas, and the rheumatoid factor went down by 30%. And joint problems never came back. So this is how it goes on and on and on, even till cancer. But thyroid issues are common, autoimmune conditions are common, gut health issues oftentimes resolve because it's directly connected to the gut and the dysbiosis. Skin eczema is always connected to that. So everything. There's a big contributor. I mean, this is foundational work that is oftentimes overlooked. I mean, it's the most underrated part in the body. Only Huberman lately put it into his first 8 pillars. So I think he had 7, then he put oral and gut health in one column for reaching. So it's foundational work that no one talks about.
So we've heard about leaky gut.
Yes.
Some people have even kind of started talking about leaky brain.
Yes.
But you mentioned leaky gum.
Yes.
And so this idea that these pathogens can enter through these areas and cause havoc in terms of your health.
Yes.
I mean, explain that to me, like how leaky gut, leaky brain, leaky gum are connected, and where we're going with that, and if that's going to be a term that we're going to adopt.
I mean, it's all the same. Basically, whatever becomes leaky. So your skin is your outside, it's a protection to the outside world, right? You know that whatever you put on your skin will be absorbed. And you also know if you have a cut here, within a minute, there's blood, and then there's like, it's getting red and inflamed and stuff. But what you don't see your skin in the inside. Yeah? You don't see that this happens from in the leaky gut all the time. And leaky gum, just simply, if you have bleeding gums all the time, that's leaky gum. Yeah. That's inflammation, that's from the wrong diet, that's dysbiosis, it's maybe even because of dental repair, metal crowns, whatever. And then you always, instead of having a protective barrier in your mouth, it's open. So all the pathogens and also the normal bacteria can just jump in there and cause neuroinflammation, for example, by activating microglia cells. That's Porphyronas. Or jump into there and then will be found in your hip joints. And yeah, so leaky blood-brain barrier is also bad. Like,
right.
The barriers are there for a reason, and if they are getting compromised for whatever reason, that's usually dental repair and lifestyle issues, then you open yourself up for another chronic health issues and autoimmune conditions and all these things.
So at least in biohacking, I would say that there is a movement against fluoride toothpaste and mouthwashes. There is understanding that mouthwash, like an alcoholic mouthwash, can kill nitric oxide and lead to, for a man, less sensation, less ability to have erections. For a woman, same thing with clitoral tissue. Maybe she won't have as much sensation, but nitric oxide is obviously critical for endothelial health throughout the body. So what are your thoughts on one, maybe this like being the start to the tide turning, and then your thoughts on fluoride and nitric oxide and those kinds of things?
Yes, so biodentist is always team no fluoride or no toxins. Basically, like also the Listerine and all the chemical mouthwashes, like you just said, they were designed to clean floors. You can use them to clean your toilet and whatever, but why would you put it into your mouth? It nukes the complete microbiome, and therefore it kills that nitrous oxide and way much more. It's also ethanol based. It's alcohol that you put into your mouth. So actually, it's marketed to give you good breath, but it makes the breath worse over time because you relying on it and kills your microbiome. But your microbiome in a balanced state is what gives you good breath. So that's something I would just throw it into the toilet. That's where it should be. And for toothpaste, it's not just the fluoride. Conventional toothpaste or conventional oral care, if you go to any supermarket worldwide, and I always do that, it's copy paste. They all look the same. It's the same companies doing the same shit. Colgate and
Procter Gamble, yeah.
Procter is the same design with different brands, same amount of fluorides. Then there's sodium lauryl sulfate so that it foams. There's titanium dioxide in it for the white color. There is triclosan in it, which is an antimicrobial. Again, there is carrageenan in it, and various other things that sorbitol, sucralose, artificial sweeteners to cover up for that chemical taste. Stuff that just doesn't make sense to put into your mouth. It's designed back in the day as a band-aid for extreme problems, but obviously it takes a little bit longer. But our lifestyle is not. We are not living the way we should live anymore. Like in nature, the body is immune against tooth decay. And in our Western world, this is the number one chronic disease, tooth decay. Even though we're better in cleaning, we have our toothpaste and Listerines and stuff and oral hygienists, still more cavities. Why? Because we got soft, we ate processed foods, we barely don't even chew anymore. So this is an epidemic of the Western world. I don't think that exists in like countries that eat more ancestrally too much. Like, let's say it depends if they have their hands on sugars and refined vegetable oils and all these hyperpalatable stuff, then yes, probably even worse because then the hygiene is missing. But if you just look at how Western price travel the world, if you really live ancestrally, people grow perfectly. They have space for all the wisdom teeth. Their teeth are hard as stone, hard as granite. That's how they're supposed to be. No gum bleeding. Gums are pink, not like light pinkish, not red. They didn't even use a brush. Good food, real. This is what I always say: eat real food. Harder foods to chew. They clean your teeth naturally. And there is no biofilm on your teeth if you eat a steak, but there's biofilm on your teeth, the fur, if you drink a Coke or if you eat some wheat bread or if you do some McDonald's or whatever. Like it's just
right.
an
So
epigenetic problem.
how damaging are high sugar foods? How damaging are these high acid drinks? I mean, now almost every drink that we're having
It's acidic.
is not just acidic, but super acidic. Like we're looking at, pHs that are close to 2 when you're talking about energy drinks and pre-workouts and a lot of these things, these sodas. They have the carbonation comes from carbonic acid and then they add citric acid and other acids on top of it. Most of these things are around 2 to 2.5 pH, which is extremely low. Super low. And then add sugar on top of it. What is the impact of these things?
Yeah, this is contributing big time to tooth erosion, making that granite, that stone, more vulnerable. So the saliva usually controls the oral pH. This is different for men and women. That's also interesting to know. So let's say men have about 7 to 7.4, and women, funny enough, depending on cycle, sometimes go as low as 5.5.
Oh, wow.
Yeah, that's why they're more prone to tooth decay if they don't mineralize correctly. And the threshold for demineralization of your enamel, which is the bad part, we want to remineralize all the time. So teeth should be having more remineralization than demineralization, getting more minerals to build that stone. Yeah. So if you go below 5.5, it's really hard on your teeth, and they erode way faster and demineralize faster and faster and faster. Imagine you drinking whatever soda or, like you just said, pre-workouts that have a pH of 3, or even orange juice. Orange juice has a pH of 3.3 or something. and you do that continuously throughout the day, this is when you wear down your tooth super fast, making it more prone to tooth decay. And then if you feed the wrong food, like high sugary foods, palatable foods, you also feed the wrong microbiome. It's not that the bacteria are in itself bad, but because of sugar and processed food, you feed the wrong ones, the more pathogenic ones that produce more acids, and then you get more tooth decay. So it's a double whammy. If you eat a, let's say, more paleo-ish ancestral diet, you wouldn't even need to clean your teeth. It's not necessary. They never get tooth decay.
That's crazy.
Let's face it, no one is that consequent.
So what are some myths that you would say that like exist today in common dentistry that's just widely accepted, that you feel so frustrated about that you want to turn the tide with, just simply listing out a few of these myths that you're just tired of?
I mean, I'm tired of, first of all, dentists are never seen as real doctors. And that's partially their own fault, because they're only focusing on the technical things, which is repairing your teeth. So if they would not be so stubborn sometimes and realize they can become real doctors that help people heal, they all would have a better life, actually, because no one likes to go to the dentist. That's why my hashtag is not a dentist. Yeah, for us, you know how it is. It's more like an overall health treatment or health optimization. So that is really frustrating. Also for the dentists themselves, it's like really oftentimes a bad job. You have to make the numbers, 50 patients a day to make ends meet, repair constantly, like discussing with patients about this is not covered by the insurance. You have to pay that yourself. So it's not a cool job, to be honest. So this is frustrating that there's so much, let's say, what is the word for this? So much ignorance in the medical world or dental world that they don't see that this is not against them. It would help them grow even better and help patients more. Because the colleagues are the ones that always shoot arrows in your back. And they tell you what he is talking about is bullshit, like ceramic implants. That won't work. They break. They don't heal. I mean, I'm doing this for more than a decade. And having placed over 5,000, I wouldn't do it if it doesn't work. But obviously you have to learn way more than just an implant. It's not the same as putting in a titanium implant. You have to understand the whole body. So that's quite frustrating. Also, obviously, that we're so brainwashed that even the more holistic biological dentists would attack me if I say in real life you don't need a floss. For example, I don't floss. I have my teeth are perfect. I have nothing in between unless something gets stuck. I'll need a floss. But besides that, on a regular basis, I avoid it because it would snap through and cause bleeding. But I get attacked for these things, or that they're so focused on these chemicals. Fluoride. I mean, this is all basically old school stuff and industry sponsored. We learn it and we get brainwashed in university, but I was always challenging the system. I was asking questions like, why am I learning this? Who invented this? This doesn't make any sense. But this is not the normal question of what I realized. Most students just like, I have to study. But then they just study it, and then it's how it is. Like, I don't believe all the things. I'm actually very skeptical. So if I meet any dentist that is open-minded but skeptical, I love it. Because then they were talking. But the emotional attacks, this is like really boring. Yeah.
So speaking of which, and we'll wrap this up with this, the holistic aspect of how you work. The idea of you not just doing these surgeries, but there is the hyperbaric chamber, there is the IVs, there is the nutrition, the supplementation. You'll look at blood work, like you'll look at like a lot of things and treat someone holistically on their healing journey. Yeah. Tell me about that. Like, why do you do these things? Like like most dentists obviously aren't doing these kinds of things.
So basically, I also had my own health issues, chronic health issues, mental health issues when I was super young, like early 20s. And this is like early 2000. There was no Google, no YouTube, no anybody that could help me. So I understand if you have suicidal thoughts and everything, but I needed to find solutions. And I basically, over the last 20 years, visited many doctors and created the doctor that I would have needed back in the day, because I had to just design the new breed. Therefore, for me, it's an intrinsic motivation to always learn and grow and contribute and create and develop new things. So it's probably just my passion and purpose in life. I was able to help my body heal by learning a lot of things from very good people and trying and doing and stuff. So I'd like to just give back. And I mean, this is why we're on that mission. It's not about us. We're just parts of it. And I always say everyone who comes here is part of the mission, because when you heal yourself, you heal the many. If you have that calling, because you will inspire other people. Just one person seeing this video maybe shares it with a loved one, and then they can help them instead of going like the chronic disease route or the mental health issue route. I mean, it's 40 million searches per day, right?
I also talk about in my book, there's two mashup terms. There's, biohacking, which is hacking your biology to make yourself healthier.
Yeah.
But there's also a term called hacktivism, where you're hacking for the greater social good. So like think of Edward Snowden, Julian Assange, these kinds of people. But I had this idea called biohacktivism, where when you're hacking yourself, you are more heads up, you're living a better life, you're more aware, you can have greater impact.
Yes.
Because instead of surviving, you are now thriving.
Yes.
And you can see someone else hurting, you can help someone else on their health journey, on whether it's mental, spiritual, physical.
Yes.
You can have a greater impact in the world as a result of you being healthier.
Exactly.
And so whether it's even with regards to bringing someone to biological dentistry, even someone who's just healthier can make greater impact.
Yes, exactly. This is why I always say to all the ones that I'm training, we have to practice what we preach. Always be a little bit ahead of the curve, because then we learn from our experience. I know exactly what you go through, partially. So I can easily be empathetic and help you, because I know where you're at, versus I'm just treating you as a robot or a machine that we need to do this and this and this. We can go the empathetic route, and I feel we have to practice what we preach. So I like that biohacktivism. Anything. I'm not a big fan of hacking usually, because I feels like you need the easy way out.
Yes,
I'm
agreed.
the hard work
Agreed.
type of person. You too.
Agreed.
So you have to do these things, and it's all about foundations. So whatever you do, you don't need to invest into a hyperbaric. First, the best parts are all for free, right? You can't change your nutrition. You can
sunshine.
You go in the sun.
Grounding.
Exactly.
Great relationships.
That's probably the most important.
Good sleep.
This is a big part that we're missing because of COVID happened. The community aspect. Mm-hmm. It feels like more and more people are just themselves with their phones.
Right.
Even though they're in a group. Like, I try to forcefully put it away, and sometimes I have to check it, but being present more, but with good people. Like we just had our dinner 2 days ago. That's just amazing. And as a kid, and I hope I have 4 kids, I hope for my kids I can manage or maneuver them so that they mainly are in the present, like we were in the 80s or 70s.
Yeah.
Growing up, there was nothing else, right? We could just do
be present.
outside and be present and do sports and use that time wisely. So it's good. I mean, I have nothing against the internet and against data and stuff. I'm a big fan of both.
Right.
Otherwise, we wouldn't evolve so fast.
Right.
But we have to go back then and go back to where we came from and mix it.
Right. I've actually talked about
again.
Yes.
Not robots. Not robots, guys.
I've talked about this with regards to biohacking. It felt like very masculine energy at first, like when we think about yin and yang or the balance, it felt very masculinized. It felt like it was about exosomes, stem cells, supplements, peptides. There wasn't a lot of the ancient wisdom that I would say is kind of like the feminine energy of self-care, like sleep, grounding, sunlight, breathwork, meditation, dance, affirmations. These kinds of things are very important to longevity as well. It does feel like there is a tide turning where people are becoming more aware of being mindful, of being present, of doing grounding, of getting sunshine.
Yeah.
Where like now this is becoming that health optimization journey, that there is like a feminine and masculine energy coming in.
Yeah, health optimization is what I like more than biohacking. Biohacking is still also. My mom wouldn't understand that word. She would ask me, "What is this?" And then we would anyway say it's health optimization, and you need to just take care of it. And I completely agree with that masculine thing. I mean, at the beginning, the role models was mainly men.
Yeah.
That oftentimes didn't even have a family, or so. How does that work? It changes right now, which is good. So there are more and more females coming into that space, and yeah, it's just more
holistic, more spiritual.
now. Yeah, but
more about health span versus lifespan.
Exactly, not just about hacking anything and doing the most fancy tricks for buying your way out, so to speak.
Yeah.
It's also about this foundation. I mean, you also, but every single morning I do sport. I do a movement, which is a part of healing. This is my meditation. I'm not a meditative guy who can sit for hours, but I'll train and do a workout that helps me, or invest in myself and become stronger. It's all important.
All right, well, I'll wrap with this. What is Wolfpack to you?
That's most important. Wolfpack is the community on a big scale. So 2019, I called I wanted to search from the lone wolf. I wanted to find the Wolfpack, and then I found the health optimization summit. I don't know if you remember, Tim invited me. I didn't know him, but I made it possible to go to his first summit. I didn't really meet him, but I met you. I was sitting in your talk, and you were like saying the same thing I was preaching about, and that's why I came to you. It's like, dude, same mission here. Let's see what happens from this. And then I think then Tim came in for his journey, his dentistry. We got best friends, and he created the Wolfpack Online, where you were in at the beginning. Then I met Chris on that journey.
Yeah.
So yeah, I always call us the Health Avengers, because I feel that we can inspire or change the game a little bit by just leading by example. And I feel that the wolves need to work together in a co-elevation mode, not competition. Competition is old school, no one needs that. Co-elevation, and then make this movement big. And I have fun just hanging with the wolves. That's the main thing. Like, we get creative together, we can do more. I think this is what I was on that planet for always, like looking for my bros to change something. That's the fun part, right? And obviously helping people, as many as possible.
We want to grow the wolf pack, so...
Grow the wolf pack, grow the health, become the health avengers. Yeah, it's all about, changing. I think we can. These days we can.
Love you, brother.
Love you
Thank
too,
you.
bro. Epic.